Okay, so now we're going to look at urine results. So urine microscopy is infection, microalbumin is protein, and there's some other weird ones like this. Let's look at infection. So when you're looking at this microscopy, ignore everything else on this page apart from white blood cells or red blood cells. That's it. Don't worry about cellular casts, Harlan casts, granular casts, epithelial cells. Don't worry about them. White blood cells, red blood cells. And they will either be negative or positive. Now this is a really annoying result because it's slightly in the middle, equivocal. I would just leave that alone, to be honest. What we'll do here is we'll just ignore that. So this one's definitely positive. Red blood cells, white blood cells. White blood cells over 100 is positive as an infection. Red blood cells over 100 or sort of in the 90s is positive. There's blood in the urine. If there's blood in the urine and no infection, that's a different matter. But that's for clinician to deal with. You don't need to deal with that. Either of these are positive, leave it alone. And this just confirms it. So this is showing there is an infection. This shows you what the antibiotics are. Now, for urines, if you want to go to the next level, okay, you can, and this is advanced stuff, right? You can go into the patient's notes, go into medication, and see if they've been prescribed an antibiotic. If they've been prescribed an antibiotic, which is an S on here, in the last few days, that means they've been given treatment for this infection empirically without the results, and they're on the correct antibiotic. So what you can do is you can go to File Entire Report, Abnormal but Expected, Other, On Correct Antibiotic. And file that. That's if you really want to go all out. But it says in the thing that you can do that. So here we have a different urine test. This is called protein electrophoresis. And basically this is usually difficult to interpret. I use a lot of difficult words here to explain things. This is basically positive. They found something here, but generally speaking, I would most of the time you're going to be passing these on. The easier one is urine Bence-Jones protein, which this is not. And on page 7 it says, Bence-Jones protein is either negative or abnormal, so that's easier to deal with. But these ones, to be honest, you're probably going to be leaving for somebody else. Okay. So urine microalbumin is a test for protein in the urine. It's done routinely for people with urine. It's done routinely for people with kidney problems and sometimes in high blood pressure. So you'll get quite a lot of these come in. So let's find out where it says about this in the booklets. So on page 7. So it says here, urine microalbumin level, ignore. Urine creatinine level, ignore. So you're only going to look at this middle one here, albumin and creatinine ratio. If that's less than 3, that's normal, take no action. If it's over 3, it's abnormal. So this is abnormal. PCR, protein creatinine ratio, otherwise known as PCR. Less than 15 is normal. This is 133, so that's quite abnormal. This I would ignore. And they've actually said here PCR over 15 is abnormal because it's the cause of these diseases, but you don't need to get into that. But basically, That's over 15, it's abnormal. That's over 3, that's abnormal, so we leave that one. So this one, ignore that, go for the middle one, microalbumin level. Sorry, I'm completely getting this wrong. So microalbumin level, ignore. This is another difficult thing. They often put things in the wrong order. So if you said last time, ACR was in the middle, and now it's at the top. Very confusing, right? So you're looking for albumin-creatinine ratio, this one. 0.9, that's less than 3. That's normal. PCR is over 15 though, so that's abnormal. This is actually, protein electrophoresis is actually normal, but again, I wouldn't expect you to be able to interpret that. And I don't even know what that is myself, so I'll leave that alone. So, but basically, yeah, the ACR is normal, and the rest we're going to leave. So, yeah, that's those ones. So, ACRs and PCRs, usually they don't come along with those extra things on the end that they have there. It's usually just ACR, PCR. So, ACR less than 3, PCR less than 15, can file. So that's urines.